So my name is Stephen Beyea, and I am a research scientist, in addition to being the Innovation Strategy Advisor to the Vice President's Research and Innovation at the IWK. A summary of what I research is to develop new diagnostic imaging technologies that have an opportunity to change how we deliver care here in Nova Scotia, while at the same time partnering with people within industry who then have the ability to take these technologies and get them out into the world. We want to develop technologies that aren't just better technology, but are actually better healthcare. We can't do that from outside. You have to be embedded. You have to be living what the experience is of the clinicians and the patients inside the hospital, talking to them, understanding what the problems are to solve, if we're really going to have any hope of having this research ultimately become healthcare that does something for Nova Scotians. Just because we do that here and validate it doesn't mean that that technology will have a hope of getting out into the world and impacting patients elsewhere. And so that is where then this sort of balanced role between the academic, publish and disseminate knowledge, but equally if we're talking about healthcare technologies and potential products, that we can't do that without industry. And industry can't do things without us, because they equally from the outside need to be able to get in and test and validate and learn. Anything we do should provide value to somebody within the healthcare system. And that value might be that it provides the exact same care but at a lower cost, or better care, a faster diagnosis, for example, if you're the patient. Or it might be that it gives information that helps physicians feel more confident about the decisions they're making. In terms of impact, there's just a lot of ways to look at that, because there's the things we've done, but then there's the people as well, and the collaborations, the students, the companies that we've helped elevate their technology and move themselves forward, the economic impact that that has had for Nova Scotia and Canada. And I think if I look back, I can think of lots of ways that I would be proud to define the impact of what we've achieved. A Canadian company who had a technology that had never been tested in the hospital before. And so with the support of Research Nova Scotia, we were the first in the world to get this technology in a hospital. And we actually just had a paper published recently that was work looking at the existing standard of care, which involves patients coming in with a certain condition, and when they arrive in the emergency department, they will get a CT. But for these patients, as I learned from the clinicians, very often, if they have this condition, they are repeats. They come back with this multiple times, and they may end up getting multiple head CTs, and therefore a not insignificant radiation dose. And so what we were able to explore using this new technology that we brought in from this Canadian company, that what if we thought about using it differently, and could show that the clinicians, in fact, with a 2-minute MRI exam that has no ionizing radiation, we could provide the clinicians with the same information and have the patient land at the exact same point in terms of their therapy, in diagnosis, all with avoiding the radiation dose. I can speak firsthand to what it meant to me and what it meant to have recognition, not just for research, but for what that research meant. And I know there's many people in this province who do tremendous work that is having impact in all sorts of different ways across the province. And so I absolutely encourage people to think about all those others around you who are doing that work that impacts Nova Scotians. And I can tell you firsthand, it means so much to not only to win, but even to be nominated for this and have that recognition.